Now, in the name of the Almighty, the most merciful and the more beneficent. And this is the last, not the least part of the common X-rays interpretation for the postgraduates of Pakistan appearing in different examinations, and for the foreign examination, including the United Kingdom zone and American zone. I am Professor Syed Ali Hazar. I am visiting professor of medicine at Jenison Medical University. I am the facilitator of line. Before I will start, that I have shown you the 10 sessions or parts of the plain radiology, and actually I have made a WhatsApp group which name is MIPME, M-I-P-M-E, MIPME, means that it is a movement to improve the poverty of medical education. This is my slogan, and I am have been delivering lectures and tutorials without any charges, and you can send your name on this number which I am now putting. So I will include this in this group, MIPME 033 613 11186 0336 131186. You are calling outside, then you include the Pakistani code plus 92 in it, and then you will send a message to include you in the group, so that all the tutorials and the lectures and questions can be answered. Now, this is the first question. At 18 years old, had in concussion due to the motorcycle accident. Common problem in Pakistan nowadays. Admitted in the ICU for observation, and then after admission in the ICU, he suddenly developed shortness of the breath. There is no history of comorbid in this patient. There was no history of comorbid in this patient. See this X-ray and try to interpretate, give the different diagnosis afterwards, or differential diagnosis. If justified, it is very good. Then go for the further investigation if it is needed, and go for the management strategies or lines of management. This is the second X-ray of 52 years smoker, recent history of ST elevation myocardial infarction. Now, reperfusion therapy received, and probably he was much better condition, but now after admission he is complaining of nocturnal breathlessness and orthopnoea. Breathlessness and orthopnoea. A 43-year-old smoker having the past history of the anti-tubercular therapy 5 years back. Now, presently he is complaining of asthenia and lethargy and the shortness of the breath. On examination, actually, the lung fields were found to be very clear. In this case, there were no added sound, and nothing is on the respiratory system examination. A 14 years old having grade 5 pansystolic murmur at TRICUSPID area. This is the most, I would say, easiest radiological X-ray or radiology of the chest. Simple one. And this is the X-ray, actually number 47 or 46, 47, a 32 years old cotton mill worker developed intermittent fever. He got cervical lymphadenopathy, which is palpable. Both jugulomoid and jugulodigastric group of lymph nodes, occipital lymph nodes, they are palpable. They are shorty and non-tender. And there was history of loss of weight and the history of arthralgia for the last 6 months. Now these X-rays should be seen once or twice or thrice, as many as you can take time, but actually the time should be 2 minutes for each X-ray and discussion for 4 minutes. This is the standard method of examination, although I am not satisfied with this type of examination. But anyway, you have to follow the rules and regulations of the different countries. So you will report this X-ray in the light of this, which is the scenario. So I will meet you again after 10 minutes. Probably I will try to answer it.